A double epidemic is coming. As COVID cases rise, an influenza wave is heading to the Northern Hemisphere. What if you get both at the same time? The coronavirus is already new territory. Its combination with influenza equally unknown. Winter will be a challenge.
And the big problem we're facing is that COVID can look a lot like flu, and that's going to create a lot of problems for our hospitals. And so one of the most important things we can do is to prevent flu in our community, and one of the most important tools we have is the flu vaccine.
Whether it impacts the behavior of the coronavirus is another thing, but a flu vaccination could narrow the diagnostic options when flu-like symptoms occur. Doctors say it's more important than ever to get your flu shot this year. Facebook has launched a vaccine information campaign. It's also banning ads that discourage people from getting the jab. As DW reporter Leonie von Hammenstein found out, demand is surging. Experts say this could be a test run for an eventual coronavirus vaccine.
A little pinprick that protects against the flu and helps make sure the health system won't be overwhelmed. Doctors are worried about a widespread flu outbreak alongside a new wave of COVID-19. The demand for flu vaccinations is higher this year than usual. People are a bit alarmed and scared, and that means that they are much more willing to get vaccinated. A flu jab is usually recommended for those over 60, pregnant women, people with pre-existing conditions and medical workers. But this year, the vaccination is available to everyone who wants one. German Health Minister Jens Spahn says anyone who wants to have themselves and their children vaccinated should and can do so. But if everyone in Germany decides to get a flu jab, there won't be enough of the vaccine to go around. If we just vaccinate anyone who wants it, then it's quite possible that the people who really need it may not be able to get a vaccine at all in the end. That would be ethically and medically wrong. To avoid that outcome, the Vaccination Commission recommends that high-risk patients be vaccinated first, then the rest of the population. Germany has never used up all its available vaccines. Nevertheless, this year the flu vaccination will serve as a test run for an eventual corona vaccination. We can learn how a COVID-19 vaccination program might work from how influenza vaccinations go this year. We'll probably vaccinate the same risk groups first. We'll have much less of the vaccine at first compared to the influenza vaccine, so we'll probably have to vaccinate gradually, starting with those who need it most. In this respect, you can see the flu vaccine as a kind of test for the population. The state and the medical profession are hoping to learn valuable lessons from this year's flu season and how to prioritize future vaccinations.
Nicola Petrosillo joins us from Italy's National Institute for Infectious Diseases in Rome. Nicola, I got my flu shot last week. Was that a good idea?
That was a very, very good idea. I did the same just 10 days ago. And I was also vaccinated against pneumococcal infection. This is a very, very good idea because we have to decrease the number of flu cases. Firstly, because flu is an infection that should be prevented for its complications. Secondly, because we have to avoid pressure during the winter season in the hospital for cases to be admitted.
But tell me this, there are studies that show that it could actually protect me against the coronavirus. Is that, can you substantiate that?
There is no evidence that the vaccination against flu can protect against SARS coronavirus 2. They are different viruses and they belong to different families. There is no interaction between the two viruses, and the vaccination against flu does not protect against coronavirus. The scope to be vaccinated is to avoid another important disease in the respiratory system that can worsen the course of a co-infection with COVID, or to decrease the pressure in the hospital of admission and intensive care mechanical ventilation cases.
But what if I do get the flu and corona at the same time?
We don't have a vaccine against the coronavirus available so far. So for your question, I have a correct reply. I just could say that if we add all the vaccine at the same time, they could be done together. Maybe next year when both the vaccine will be available, they could be done together.
New Zealand has seen a 99.8% reduction in flu cases following its COVID-19 response. Is that because so many people are so much more vigilant about washing hands, wearing masks?
This is a possible explanation, the most likely explanation, that the measures to reduce the spread of coronavirus can reduce also the spread of flu. This is correct. And in my opinion, if we use properly masks, wash our hands, and we have a physical distancing, we can avoid both flu and COVID. And the fact that in New Zealand the number of cases of flu is so dramatically decreasing can, in my opinion, be due to the adherence of the people to mitigating measures for COVID.
What's your research reveal on geographical differences on the spread and severity of the flu and COVID?
Both flu and COVID are transmitted in the same way. That is the respiratory way through droplets and the contact. However, COVID patient can transmit infection to one COVID patient to 2.5 persons on average, whereas transmissibility for flu is lower than is around 1.5. And the case fatality rate is around 5% up to 15-20% in people older than 80 years old for COVID, whereas for flu, the case fatality rate and mortality is lower than 1%. And this is the big difference between the two diseases in terms of epidemiology.
Nicola Petrosidou, thank you very much for joining us today. A brief look at some other coronavirus stories making news. Another setback for hopes of a vaccine anytime soon. Johnson & Johnson's clinical trial of its COVID-19 vaccine is on hold after a volunteer came down with an unexplained illness. Eli Lilly has also paused a clinical trial of an antibody treatment. Two Taiwanese companies have designed a COVID rapid test using electronic chips. A coating on the biosensor attracts and binds with the RNA of the virus. Then the flow of electrons through the semiconductor changes, showing a negative or positive result in a few minutes. And researchers in Japan have used a supercomputer to show how humidity affects the dispersion of coronavirus particles. The findings suggest contagion risks are higher in dry indoor conditions in winter. They say humidifiers could help limit infections when window ventilation is not possible. Over to our science correspondent now, Derek Williams, for another bookshelf instalment of his Q&A viewer segments.
How do you make a vaccine for something that mutates?
I get asked this a lot. To answer, we have to look at the process of evolution. Now, just like with living organisms, the genetic code that governs how a virus is made changes from generation to generation, sometimes in small ways, sometimes in big ones. The progeny, if they survive, eventually will become separate strains that are distinct from their common ancestor. Their genetic code has changed, and that can change how they look, their structure, and also how they interact with potential hosts. For example, whether they can cause more or less severe illness. What's key to creating a vaccine is the speed at which these changes occur. In viruses like the ones that cause influenza, for example, which have genomes that are less stable, the rate of change is so rapid and random that we need a new vaccine to fight them every year. We have to play catch up with flu bugs all the time. Fortunately, due to the way that SARS-CoV-2 makes copies of itself, its genome remains relatively stable. As far as we can tell, worldwide, there isn't a lot of genetic variation yet among all the novel coronaviruses circulating in different parts of the planet. And because those groups are so homogeneous, theoretically, a vaccine that can prevent one should be able to prevent them all. What's interesting and kind of scary is that when we start to prevent infections with a vaccine, we'll also start forcing SARS-CoV-2 to change in ways that will allow it to get around the vaccine. But that's a different question.
Finally, the pandemic has been a letdown for live music lovers. Many concert halls remain closed to prevent the spread of the virus. So members of the New York Philharmonic have decided to take their music to the public. They are now staging performances on the city's streets and in parks. The setting is a far cry from the Philharmonic's usual venue, but it gives the musicians a sense of purpose and is likely to attract new fans.
And also Reinhardt, Curtis Stewart, Fiona Simon.